Hi, this is Jacqueline Eckern with Eating Disorder Hope, and today I have the honor of interviewing Miki Johnston. She is a therapist specializing in private practice in Dallas, Texas. She also is an avid public speaker and a contributor to a really important book that we're covering today, discussing caretakers and what needs they have and how to meet those needs and how to thrive as much as possible in that role rather than be drained. And they have written a book called By Their Side, and By Their Side is also has a fabulous website. There's a book and a workbook for caregivers that has 40 different contributing voices to it, so it's really powerful. And Miki has kindly offered to share some of her thoughts on the book today. But real quick, before we dive into that, I just want to tell you a little bit about Miki. She's a very experienced LMSW supervisor.
LCSW.
Excuse me, LCSW supervisor. And she practices as I said, in Dallas, covering anxiety, depression, body image issues. And she also has a very good website where you can learn more about Miki at mikijohnstontherapy.com. And I will include that with the surrounding materials with this interview. So with that, I'd like to open it up to Miki to address the crew and tell us about the book and the workbook and your thoughts on this.
Jacqueline, thanks so much for having me today. What an honor it is. I have a real passion for this project, By Their Side. And this is the second go around of this book, the second publication. The first book was, Does This Sound Familiar? And that was the first book that was published by Laura Lynn Bell. And then they went ahead and launched By Their Side with a workbook, like you said, and it is a fantastic pairing for mental health and eating disorder for families that are taken care of and who love somebody struggling with an eating disorder. It is filled with resources for families and caretakers. And one of the things that I love most about this book is it's not filled with a bunch of science. We have the science on eating disorders, and it's really important in the work that we do. But a wonderful thing about By Their Side is that it's really more of a national resource book that has these compassionate and personal testimonials that really speak to what so many people are struggling with when they love somebody who has an eating disorder. Another thing that's great about this is it really drives the reader to the professionals. And there's nothing more wonderful than the support of family and friends and the eating disorder community and things, support systems like that. But this book really drives you to the professional, because we have to remember, especially with eating disorders, that we are limited as caretakers in what we know and the support that we can give. And until we can access professionals, then we're not using all the tools that are available to us. So I think that's great. A really critical component to healing is, and to full healing, is getting the caretaker to the professionals in the community.
That is so wonderful to hear you say, because we agree with that at Eating Disorder Hope too, that it is absolutely ideal to have eating disorder treatment specialist, a therapist, a nutritionist, sometimes a psychiatrist or a doctor involved to have optimal care for the individual dealing with the eating disorder, but the caretakers often get left unaddressed, and it is so draining. So what kinds of tips do you offer and suggestions in the book and workbook that they would find helpful?
I think what's most helpful is I love how the books, I love the table of contents actually, because it really breaks it down and makes it clear for the reader to know, you know, everybody has their, when we pick up a book like this as a caretaker, we could all be in very different places.
Sure.
So, in terms of the intensity, the magnitude, the breadth of the eating disorder. So when we pick up this book, what's really wonderful is the table of contents really guides you to where you need to be. And targets very specifically the resources that are available for the issues that you're concerned about. And again, it's national. I'm in Dallas, but the book is national. So that's great. So it's for everybody. And actually, it's international. In some cases, there are references to things overseas in Europe and beyond. So that's terrific as well. What I love about the workbook is it really guides us. And I'm going to show you a cover of the workbook.
Thank you.
See it? Yes. And it really guides the caretaker, in tools that they need in order to begin to figure out, is this an eating disorder? How can I take care of myself? And looking at the different diagnoses, whether it's anorexia nervosa or whether it's bulimia, whether it's binge eating or any other kind of specific eating disorder. We're seeing a lot now with orthorexia. And so this book really helps you to understand, what is it that my loved one is facing? It helps us to understand symptoms and signs. And it talks about genetics because eating disorders are often a family illness. And that's not a statement of blame. I think it's important to understand that when we say it's genetic or it's a family systems illness, that's not saying, oh, my mom caused it or it's my dad's fault.
Excuse me.
God bless you. I know you're dealing with some allergies. It's really not a statement of blame. What it is it helps us to understand our part and our responsibility in the treatment and how we can be most effective. What is our role? So I love that aspect of it. And talks about, accessing registered dietitians and nutritionists, which is also very key because those are the ones that really have the tools to guide these caretakers. A lot of people think that eating disorders are about food, and really they're not very as much about food as they are about the dynamics of the family and issues of control and perfectionism. And so, especially in our society where people are praised for being thin, and there's so much focus on body shaming and body image and body dysmorphia and distortion, that it's really important for us to change our language at home. It's less about what's in the pantry and sometimes much more about the language that we use and how we can really begin to be most effective, both, and the workbook is so terrific for this, but so is the book, and I showed the workbook, but here is my very tabbed version of the book as well. But how do we respond, and both emotionally and with our language to be most effective as caretakers? And again, how do we access these resources when we begin to wonder if there's an issue or a problem? Does that kind of answer the question in a broad
Absolutely. And
stroke?
how about with caretakers when they're dealing, they may have a presenting eating disorder, but co-occurring issues. Can you address that, how they deal with that?
Yeah. So that's a great question, and a very prominent issue. Oftentimes, eating disorders, there's a coexisting condition. Something, it could be obsessive compulsive disorder, it can be anxiety, it can be depression, um, uh, and even more pared down than that is these issues of perfection. Although perfection is not a disorder, it's not in the DSM.
Yeah.
It's an indication of something bigger that's going on, and so it's really important. Oftentimes borderline personality disorder as well is another coexisting or co-occurring disorder with eating disorders. So we're not just looking at eating disorders, but we're really looking at what are the mental health conditions that are driving the eating disorder, and how can we make sure that there is accurate assessment and diagnosis so that we can point each person, each unique person with their unique situation, in the right direction.
That is great to be giving that leadership to caregivers and loved ones dealing with those facing eating disorders, because I think it can be overwhelming when there's multiple issues presenting, and directing them towards professionals really is so crucial to get the guidance they need. And yet at the same time, I love that the book and the workbook has some almost, if you will, self-help sustaining support for these caregivers. How do you go about using the book and the workbook most effectively as a caregiver?
So I recommend using them together, actually, to read the book and do the exercises in the workbook. And you'll come up with a lot of questions, because you're going to be discovering a lot of new information. So I think you should use the book and the workbook together and find your own therapist. Find somebody who you can work through, or your own group, your own support group, in the community, but to make sure that you have a place where you can talk about what you're learning as you're reading, because the reader is not alone. Um, and so it will, like I said earlier, when you're reading the book and you're doing the workbook, it's going to really prompt you to find therapeutic support, and put you connect you with professionals in the community. And I think that trifecta of the workbook, the book, and finding a support system, a professional resource, is really the best way for the caretaker to make the most of the resources in the book and the workbook.
Thank you. And are there some suggestions or helpful ideas for caregivers during this time of sequestering and the coronavirus that could be helpful?
Yes, there really is. There are so many resources online. I mean, I know that Eating Disorder Hope has resources. So what I recommend is to Google, because we're living through our computers right now. And it's so unfortunate when people don't have computers and they don't have access to the internet. But if you do, one of the best ways is through the book. There are dozens and dozens of incredible resources in the book, hotlines and support groups and professionals, is to seek out support during this time of what feels like tremendous isolation. Um, we're sequestered to our homes at this point. In many cities, more it's been mandated more strictly than in other places. But what's really important is during COVID-19 and during the shelter in place, as a caretaker, we want to be able to make sure that we are using mindfulness tools, and so that we can de-stress, make sure that we are accessing healthy, supportive social media that's giving us tips and tools, not just on mindfulness, but on how to speak kindly to ourselves, how to, and how to recognize these triggers that really come up when you are isolated in your home with somebody who is struggling with an eating disorder, and what that brings up for you. And knowing that it's okay to feel stuck, to feel scared, to feel anxious, but to know that there is help, that you do not have to be alone. Through the telephone, through the internet, you can use the resources that are provided and by their side. I know that it can also be extremely frightening if we have, as a caretaker or a caregiver, if the person we love relapses into, their eating disorder behaviors. And there's such a lack of medical resources right now. The hospitals are so overwhelmed with COVID patients and people with COVID complications. And so it's important, again, to find resources in your community that you can access. You can do Zoom conferences just like this. There's support groups online. I can't tell you, there's just been a tremendous outpouring from the eating disorder and mental health community. And so it's been terrific, and those resources are out there. I just can't say enough how important it is for the caregivers and the caretakers not to blame themselves for what they feel, the emotions that come up, to be careful not to slip back into our old enabling behaviors, and to reach out and get the support that you need, so that you can help yourself, but also help the loved one that's struggling.
Well, we are so grateful for your work and the work of all the folks involved in putting together By Their Side. This is huge. There's not enough resources out there for caregivers, and Eating Disorder Hope is going to be featuring the book, and we will do all we can to support your work. We really encourage you to check out the website too, which is bytheirsidebook.com. And then again, Miki, we just so appreciate your insight. You're obviously a very seasoned and experienced therapist, and I wish you were my therapist after this interview. I think her website, again, if you would like to look into her for her private practice or a speaking engagement, or just need to reach out to Miki, it would be www.miki, M-I-K-I, johnstontherapy.com. And again, we will be sharing her link on the site too. Miki, thanks for your time. Be well. And I apologize for the allergies.
No problem. I do want to do one more plug for the book if I can.
Yes, please.
Their website is www.bytheirsidebook.com. And if you want the book and or the workbook, I recommend getting them both together. You can get it. Amazon is not currently delivering any books. It's not just By Their Side, but they're not delivering any books during this pandemic. And so if you would like the book, you can have it for $10. They are running an incredible 50% off special, free shipping. It can be at your door in just a matter of days. And I think that's a great tool during this COVID epidemic. So bytheirside.com, you can order the book there. It will be shipped to you. It's 50% off. And also just wanted to say how important it is in the book to read the testimonials so you don't feel alone. This is a time, during this isolation where we really begin to feel like we have nowhere to turn. And that's not the case with By Their Side. It's really a wonderful resource. So thank you so much, Jacqueline, for having me. And I am doing telehealth during this time.
Wonderful.
So I am available for video conferencing as well. So video sessions. Thank you.
Excellent. Thank you, Miki. Take care.
You too.